So, how will you know when it's safe to return to work? A New York City startup may have the answer. Cleared for Work, an app designed to help employers monitor COVID-19 symptoms to manage when employees can return to work. Joining me now, Dr. SOUMI EACHEMPATI, whose company developed this new app. Doc, welcome to Chasing News. How are you?
Fine, thank you.
Doc, I understand you're retired and you've been recalled out to the front lines and you are working with COVID patients. So thank you for what you're doing every day.
Thank you.
Let me understand this app. It's based on a questionnaire. It's not based on any doctor analysis or some kind of a physical review.
Right. So the app is based on questions that the employee will use, coupled with any test that he may have had, and it uses them both in combination to give a status that the employer can check to see if it's safe for this person to be in the workplace.
Human beings have an immune system. We've had pandemics before. Where do you see this end? And do you see this as long-term for even in flu season?
Certainly the app could be used long-term in every flu season, but I'm actually very discouraged about some of the antibody data that's coming out. We don't know if it's going to be proven, if it's going to be effective, if levels are going to be needed to see if someone is safe to go back to the workplace. So people hanging their hat on antibody testing, saying whether somebody should go back, I think will be disappointed. So they need really another alternative to know if it's safe to start going back to work. And if they do, they need a monitor to see who should be probably isolated from the workplace so no one else gets sick.
All right, Doc. Appreciate you. Thank you very much for coming on.
Thank you.
Let's bring in tonight's A+ panel, see what they think of this new app and idea. We're joined by Afia Yunus, immigration attorney. Good to see you, Afia. And Matt Rooney. He's an attorney and the publisher of the Save Jersey blog. Afia, I'm going to start with you on this. This seems to me to be unnecessary and potentially discriminatory. Another thing that may keep us in a perpetual state of crisis. What do you say?
Part of the new normal is that we agree, Bill. It does feel a bit icky to me. I could foresee this turning into a way of discriminating against people who have certain health conditions, diabetes, high blood pressure, and just saying that they're high risk for COVID and not allowing them to come back to work.
That aside, I am slightly encouraged that at least somebody's talking about getting America back to work, including New York and New Jersey. So is this a positive step, even though maybe it's dangerous?
Well, it's a mixed bag, right? Because we always knew that it wasn't going to be Governor Cuomo or Governor Murphy that was going to get us back to work. It was going to be private sector innovation. Companies were going to invent better testing, better diagnostic tools to allow us to figure out who we really need to protect and who's safe to kind of lead the way in reopening the economy. That being said, Bill, so many of these conversations are premature because these scientists and doctors are making it clear they still don't understand this thing. So I think at some point we're going to get a better sense of who's really vulnerable, and then these tools are really going to help us get America back to work.
All right. Thank you, guys.